Good afternoon to everyone present here with us today.
Okay.
This is Shreyan from IGCP. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. Murugan Shankaranantham. Sir is senior consultant in HIV and sexual medicine at Tamil Nadu. Sir is former national president at Indian Association for the Study of Sexually Transmitted Disease and AIDS. With the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is vulva and vagina, pride of women. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him. Over to you, Sir.
Good afternoon, everybody. Thank you, moderator. I thank the MedTalks IJCP for giving me an opportunity to meet all the friends in this good afternoon. And today's topic is vulva and vagina, the pride of women. But I put as a journey towards the pleasure hunt because the whole men population in the world is hunting for this pleasure hunt. So that is why I put that. And most of us, this is the birth passage about which we know very little. There are many things yet to be revealed, but I want to share few things with you all in this good afternoon. Vulvo-vagina, the treasure hunt. Vulva, as we have put in the title, is the pride of any woman. Vagina means sheath in Latin, the sheath of a sword, the sword holder. It's a sword holder. Naturally, it's a sheath. The chance of a girl born without a vagina is around 1 in 5,000 to 7,000. They put in the online, but it is more than that. It is called as vulval agenesis or vaginal agenesis. Average size is around any vagina, it's around 2.5 to 3 centimeter in width and 3 to 4 centimeter in length, with multiple rugosities or vaginal folds inside the vaginal wall, which allow vagina for continuous stretching, enlarging. Sperm can be viable in these vaginal folds for more than 5 to 8 days or 9 days, even after the intercourse, and can make the men hungry at the time of ovulation. Allergy to seminal plasma is not very uncommon. Vagina, the normal vagina is a collapsible cylinder like thing, just like a deflated balloon or a stockings without a foot. The vagina is a complex tubular structure that has reproductive function, support for the uterus, barrier function to the microbes. Average vagina is around 3 to 4 centimeters in length, as I have told already. Expands at least twice as it in size with rugosities and crypts in the vaginal wall, especially when it is stimulated. When the vagina aroused sexually, it enlarges vertically. After menopause, the clitoris will be will shrink compared to their teenage times. 85% of the couples in US used to have discussions about their preferences, sexual preferences, to avoid sexual boredom. Vulva comprises of mons pubis. Everybody knows about the medical profession. Everybody knows mons pubis, labia major, labia minor, fossa, vestibule, urinary orifice, vaginal orifice, so perineal raphe and anus. So all these things, vaginal orifice, everything, it's a normal thing. Variations of vulva is quite possible, quite normal, quite common. As in men, the prepuce is maybe various size, tight, elongated, and short, or sometimes retracted prepuce, or totally open prepuce. Like that, so many things are there. Similarly, here also, mainly the labium minus and the hood of that clitoris have variations as depicted in this picture. We can see lots of variations. Family, it is depending upon the genetic nature, nothing to worry about that. Child vulvagina is lined by a single layer of cuboidal epithelium, whereas it is lined by stratified squamous epithelium in adults. The stratified squamous epithelium offers a high degree of resistance for bacterial infections. Likewise, child vagina have a pH of towards alkaline side, whereas in adults the pH ranges from 3.5 to 4.5 in adults due to the presence of lactic acid, which is produced by the gram-positive lactobacilli, which is otherwise called as Doddridge's bacilli, which thrive on the glycogen present in the vaginal epithelium due to the action of the estrogen in adults. So during after menarche, because of the estrogen level, then the cell will be containing lots of glycogen on which the daughter bacilli will thrive and produce lactic acid, which is responsible for the acidic pH. Is once again offers a high degree of resistance to infection. So comparatively, adults are more immune to bacterial infections because of their lining epithelium and the acidity, in spite of their risk like sexual behavior, menstrual behavior, everything. Complete inactivity of the sex for years will lead to vaginal depth shortened, disuse atrophy. If you are not use it, you will lose it as with any organ of our body. Regarding the secretions, vaginal wall has actually no glands as such. Even though it is moist, it has no glands at all. Endocervix has glands. The accessory reproductive glands are Bartholin's gland and Skene's gland, which are Bartholin's gland present in the labium majus, the lower one of the labium majus, substance of the labium majus, whereas Skene's gland present on the either side of the urinary orifice. Whereas the maximum lubrication during sexual arousal is not due to the endocervical secretion, but due to the transudate. When there is, it's not actually gland but transudate, like our perspiration, sweat glands. When there is increased blood supply around the vagina, when the individual stimulated. The smell of the vagina differs person to person, depends on her diet, normal bacteria levels, sweat, the apocrine glands, and hygiene. Sexual act keeps the vagina moist, soft, even when there is low estrogen level. Vaginal farting is not abnormal, it's not uncommon during the sexual intercourse. Don't make any comment, instead encourage her. The normal vaginal discharge is a healthy discharge. It secretes small amounts which helps in cleaning, self-cleaning. It has a natural property of self-cleanliness and moisturizing. Also has a protective role. About the protective role, it is already told that the pH of the vagina, and other than this, normal volume is 1 to 2.5 cc the vaginal discharge at any time, and it will be usually either transparent or white, maybe thick or thin. It is not odorful. What is odorless? Increase in amount around the menstruation and sexually aroused, or with use of some medications. Vaginal discharge has the side picture also. When it is clear, it indicates healthy discharge, pregnancy, ovulation, hormonal imbalances, etc. Gray It indicates bacterial vaginosis or bacterial vaginitis. Pink, when it is pink, it's cervical bleeding. It indicates cervical bleeding or vaginal irritation or implantation bleeding, like that. White, the curdy white discharge sometimes may be due to candidal infection of the vagina, monilian or candilian. Yellow green is maybe due to sexual transmit like trichomonas vaginalis infection, like that. And it is a false belief the STI infection, the vagina will be odorous. It's not so. All the STI discharge is not odorous, especially gonococci, candida, non-gonococcal chlamydia, all these non-odorous. Only the bacterial vaginosis and trichomonas vaginalis has some odor. The major odorous discharge is due to foreign body, secondary infection, anaerobic infection, or cervical CA cancer, etc. Otherwise, it will not be so odorous. And if it is red, it indicates menstruation, cervical infection, cervical polyp, endometrial or cervical cancer. So these are the characteristics of the vaginal discharge. The vaginal ecosystem, we have to know about this. The estrogen increases the glycogen content of the vaginal mucosa, on which the daughter means bacilli thrives and converts into the glycogen into lactic acid. I told already. And it makes the pH as to 3 to 4.5, 3.5 to 4.5. Facilitates the growth of daughter bacilli, inhibit the growth of unfriendly bacteria. That is very important. We have to know much, about which we'll talk later. Vagina is like a garden. Vagina contains an army of good bacteria which help to keep the interior healthy. The vaginal microbiome is like a garden of all different kinds of bacteria that function together to keep the vaginal ecosystem healthy. Good and bad bacteria. The good bacteria produces substances that create a slight acidic environment which stops any bad bacteria, which prevents the growth of bad bacteria, pathogenic bacteria, as well as mucus, which keeps everything lubricated. This is why wiping inside the folds with antibacterial wipe is not advisable. It is important to keep the balance of the bacteria undisturbed. Similarly, using a hair dryer to dry the vulva is also not good. The skin is meant to be moist there, like our mouth. The normal flora contains lactobacilli, protects the interfering with adherence of the epithelial cells from the other bacteria. So maintains the vaginal pH to normal lower level, less than 4.5, which prevents the growth of the other bacteria. Other bacteria are facultative organisms like diphtherides, streptococci, E. coli, urea plasma, mycoplasma hominis, urea plasma urealyticum. Anaerobic bacteria like peptostreptococci, bacteroides, fusobacterium, all these things can be there, and they will not kept checked by the normal good bacteria or healthy bacteria. Vaginal microbiota, the vaginal microbiome is an intricate and dynamic microecosystem that constantly undergoes fluctuations during the female menstrual cycle and the woman's entire life from childhood onwards. As that of oral cavity and the gut, vagina also have a lot of microbiome naturally. Vaginal moisture, warmth, poor aeration due to the collapsible cylindrical tube by nature, it becomes a amicable for inhabitancy for wide varieties of the organisms. The vagina harbors a huge microecosystem contains billions of microbes. These microbes may be the predominance of lactobacillus, actinomycetes, clostridials, bacteroideals is observed in pregnant women. In non-pregnant women, the predominance of the lactobacilli, actinobacteria, Prevotella, Veillonelacea, Streptococcus, Proteobacteria, Bifidobacteriaceae, bacteroids, and Burkholderies. All these things may be there. Yeah, even the lactobacilli, there are different types of lactobacilli are there. We have to know something. There's lactobacillus crispatus, lactobacillus gasseri, lactobacillus inners, lactobacillus jensini. All are good bacteria. The vaginal pH increases, the lactobacilli decrease, and aiding proliferation of the pathogenic bacteria and also the candida, which may lead to bacterial vaginosis or vaginal thrush. Imbalance in vaginal pH can occur. What are the situations? Unprotected sex. Semen is an alkaline media that favors the growth of certain bacteria. Antibiotics, prolonged antibiotics, oral antibiotics will kill not only the pathogenic bacteria but the normal flora, healthful flora also. So, because of that also, the vaginal pH can change. Menstruation increases the pH in the vagina. Pregnancy, there may be vaginal pH changes. Frequent use of harsh soaps, chemical douche, infections like bacterial vaginosis, all these things may alter the vaginal pH. The milieu interior of vagina, milieu interior is kept in everywhere in our skin, intestine, in the whole system, lungs, blood, everywhere. So it has to be normally maintained. So similarly in vagina also, the host provides a humid, nutritious and warm habitat for the microbes, whereas the resident microbiota produces antimicrobial and anti-inflammatory factors. The normal healthy microbiota produces antimicrobial and anti-inflammatory factors. This balance can be broken by internal or external factors. The alteration of the host environment impairs its ability to control the opportunistic pathogens contained in the resident microbes that could invade the human body and cause illness. Hormonal variations can occur right from the childhood onwards, childhood, adults, during menstruation, non-pregnant, pregnancy state, and after menopause. There may be continuous changes, there may be alteration of the interior milieu. The dysbiosis, vaginal microbe forms a homeostatic, mutualistic relationship with the human host and plays an important role in the vaginal health and also in the disease status. Dysbiosis is defined by an imbalance in the bacterial composition, changes in the bacterial metabolic activities, or changes in the bacterial distribution within the vagina. This dysbiosis may be of three types: loss of beneficial bacteria, overgrowth of potential pathogenic bacteria, and loss of overall bacterial diversity. Any factors leading to dysbiosis end with overgrowth of bacterial and fungal organisms which are pathogenic to human beings and leads to sufferings of the individual. Dysbiosis can occur in situations like in the women of reproductive age, physiological changes such as fluctuations in the hormonal levels, sexual activities, menstruation can cause variations in the vaginal microbiome. Apart from this, as we have told already, broad spectrum antibiotics, not only this broad spectrum antibiotics, any antimicrobials, antiseptics, and sometimes even the metronidazole, nitazole group, which is useful for control of the anaerobic bacteria or some other using for the gastrointestinal infections. that are also affecting the normal flora and helpful helping the pathogenic bacteria to flourish. And vaginal pessaries, douching, over-enthusiastic washing with soaps, antiseptics, oral contraceptives, steroids, systemic and local, sexual activities will all have the influence on the microbial flora. Use of antibiotics and ointments containing steroid locally disrupt the epithelial barrier, altering the normal vaginal flora, affecting its pH. Vaginal wash, even though they put as lactic acid 1.2% water by volume, tea tree oil, sea buckthorn oil, vaginal washes can ruin the pH balance. So it is best to clean your private parts with plain water, preferably lukewarm water. Not to use the douche or clean the deeper areas. It's self-cleaning properties there. Not necessary to bother about that. So the pH is around 3.5 to 4.5. Anything above may be due to these vaginal wash or soaps or some other bacterial infections. Instant wash also not good. But the P-Safe toilet sanitizer spray, it will not affect the interior and it will helpful from the skin diseases which can be transmitted through using a common toilet. They can use it. We are not using it in for the vagina interior. Vaginal spa, it is said to be healthy by the alternative system people. Vaginal steaming is an alternative health treatment whereby a woman squats or sits over the steaming water containing herbs such as rosemary, wormwood, basil. Vaginal steaming is marketed with the pseudo-scientific notions of balancing female hormones or revitalizing the uterus or vagina. It is not so. It is also marketed as cleaning the vagina, which it does not do. The tattooing, piercing also should be discouraged. Hair removal. Many people feel the removal of the hair is a healthier and cosmetic appearance, but it is not necessary. Regular hygiene bathing is enough. When you wax or shave, you are causing microscopic trauma to the skin. We see cuts, abrasions, infections for the pubic hair removal as well. So all microscopic may not be seen outside, but it may be possible. So one can get folliculitis, furunculosis. Make sure the hair removal practitioner does not double dip the wooden sticks into wax. It should be used once. Double dip should not be done, which could spread the bacteria between the clients. If shaving is preferable, not usually not necessary, if shaving preferable, use a clean razor, use only disposable only one time and use in the one direction only, preparation of the skin appropriately with the moisture and avoid increasing the ingrown hairs to avoid we can get infected and it has to be cleaned in a good light and these are the things we have to remember if we are intent to clean. Pubic hair has a function definitely. It is probably a mechanical barrier protection for the skin, have a cushion effect and also helpful in the sexual activity. It may also have a role in sexual functioning because each pubic hair is attached to a nerve ending. That's why it hurts to remove it. Challenges in women. The urethra is comparatively shorter, so the infection go up, ascend easily. Menstruation, usage of sanitary pads, sexual activities, close approximation of the external genitals to anal orifice, all really challenges. Foreign bodies likely to be left over, condoms, tampons, parts of condoms, tear condoms, tampons in the last day, forgot to remove, menstrual cups, etc., and other things. Even sometimes masturbating instruments. Needs cleaning every time after toileting because of the last part of the urine dribbling over the skin. Adequate intolerable restroom facilities for women is there in our country, so it has to be looked into to improve their health condition. Lack of privacy to change pads, faulty washing habits. Faulty washing habits, the vulva has to be washed only front to back, never back to front. Back to front may lead to change of flora from the gut to vulva vagina, so that may induce infections. More risk in women, other risks. More area is exposed during sexual act. Wide area is exposed inside. Receiving end. So the infectious material, if the individual have something and someone contains some virus or bacteria, it may remain for more time. In spite of the individual men can wash immediately, but women cannot wash inside. So it may remain for more time. And vagina have a capacity to self and spontaneous cleaning tendency, even though that is there, but it may remain more time. Not able to visualize the intravaginal part. So some may not be able to visualize the even their external genitals also during pregnancy, obese individual, lack of privacy, inadequate lighting facility, etc. Obviously, the internal genitals, so most of the STI conditions, whether discharge or growth or wart or ulcers, individual may not be aware that she is having at all. Whereas in men, it will be obvious and they will come seek for help. Whereas in women, it may not be obvious. Even like that, CA or tumor or growth also may remain symptomless and the patient will be totally unaware. Difference between children and adults, pH lining, everything as we have already intimated. Other challenges, partners' sexual genital hygiene, especially men who never bother about to retract their prepuce and clean. It has to be done every day. If they are not doing, presence of smegma, presence of other bacteria and some secretions, all will irritate the women's organ also. So that is also we have to keep it in mind. And most of the STI remains asymptomatic in women. Women are comparatively weaker sex and fall prey of men's sexual drive, and they have depending upon for money, so they are vulnerable for abuse. So all these things are really challenges for them. One more thing is flow seminis. Most of the women used to ask me, that is after coitus, if they are having infertility, they used to ask, after the coitus, most of the semen comes out when I'm getting up, when I'm changing my position. It is normal. So naturally the semen ejaculum is more than what is necessary. Only one fourth or one fifth is necessary and it will enter. There is no, there is, you can imagine when you are having a dip in the river or a pool or some sea bath, everything, everywhere, you can have water entering through your nose, ear, mouth, never through the vaginal opening. So vagina, it cannot enter, and there is no. If it is entering and it will reach the stomach, uterus, what will happen? She has to she has to drown. So like that, it will not go inside. Only few drops will enter through capillary action. Remain will help to titrate the pH of the vaginal secretion, and this makes the sperm viable for more time and can make the it can swim up into the cervical os slowly. So that is the purpose of the seminal plasma, and then it will come out. So not to worry about that. Flow 7 is most of the part of the semen will help to titration of the vaginal acidity and expelled out. Feminine hygiene. Nearly 50% of the girls in India know nothing about the periods, menstruation till they experience their own. Only 16% of the women and girls in India use sanitary napkins due to cost effect. 28% of the women and girls in Indonesia missed work due to their period. 60% of the women and girls in Nepal avoid social gathering during menstruation. 13% of the girls low and middle income countries missed school due to menstruation. How can we help across the proper sanitary facilities, access them to proper sanitary facilities, provide a toilet, privacy, lighting, all these things we have to provide. Otherwise, it will be a challenge for them. Pleasurable head. At any given moment, almost 65,000 couples are having sexual intercourse across the world. 87% are having sex once in a week. Greeks are said to be having more sexual frequency in the world. According to a survey in 2012, British people are prefer to have the sex in the night or light of darkness. Women reach climax much slower than men. That is, we have to know everybody. Men are ready like a switching on the bulb immediately light, whereas women will take time like a iron box. They will take time to get heated. So the woman needs at least 15 minutes stimulation to reach orgasm, whereas men below 40 years achieve erections within 40 seconds. Doggy position or rear entry of the sex is said to be produce more arousal lubrication in the women. Facts about the pleasure hunt. Women attracted by older men than their age, believing that they will take care them and their offspring. Women preference is in sex also varies widely. Some prefers just gentle touch, whereas some prefers intense sexual stimulation. Women have two erogenous zones. One is G spot, another is cervical opening. And lower one third of the vagina only is innervated. Upper two third is not sensory, provided with sensory nerve endings. Women have more pressure in masturbation and self-stimulation of the clitoris. Clitoris have 9,000 sensitive nerve endings, almost double that of the glans penis. Flower needs butterflies tickling. Stimulation with a tongue kindled her desire for sex, very much gentle caresses. Approximately 70% of the women under 40 expresses their desire to have sex thrice in a week. Men consider women or young men consider women to be young, healthy, not conceived previously, with small waist, with full hips and large breast. Clitoral orgasm will have 5 to 15 contractions within 10 to 30 seconds. Researchers showed that women engaging in masturbation are less likely to develop type 2 diabetes. When a woman experiences the organism, releases endorphin, often refers to the happiness hormone. The proteins in the semen, when rubbed with the skin and mucous membrane, it provides anti-wrinkle property. Wonders of the treasure. When the vagina gets stimulated, it can enlarge vertically up to 200 times during labor. Female orgasm is divided into G spot, clitoral, and vagina. Vagina lower one third only. And women can have multiple orgasm and mixed orgasm, whereas men have only one orgasm at a time. Many more secrets yet to be revealed. Yes, we'll wait for that. With this, I will finish my talk. Thank you very much for for your patient listening. Thank you very much.
Thank you so much, sir, for your wonderful presentation. Sir, we do have some question from our audience if you'd like to take that up.
If you can put it in the chat box, it will be better.
Sure, sure, sure,
Okay,
sure, sir.
okay. Please go ahead.
So I've put up the first question there. You can
Yes,
take it
please.
from there.
Local estrogen therapy will be helpful in menopausal women, especially menopausal women. Yes, after the decline of estrogen level, that vaginal atrophy will be there, shrink, and it may irritate, and the application of the estrogen will help them to an extent. But more than that, regular usage is also must. They should not stop once menopause attained. When they are using it, they will have some amount of better things. And that estrogen, topical estrogen, will help in the menopausal women. And what are the indications for the surgical interventions in the vulvar conditions such as Bartholin cyst, abscess, vulvar intraepithelial neoplasia, vulvar cancer? Vulvar intraepithelial neoplasia, vulvar cancer, I am not the person to be asked, and it is necessary to be referred to oncologists and they will do appropriately. Regarding the Bartholin's gland cyst sometimes may need marsupialization. And regarding the abscess, you have to investigate her vaginal secretion with a speculum examination and cervical, especially cervical discharge, and stain it with the gram stain, Leishman stain. Look for the organism, or sometimes even you have to send it for PCR test for various chlamydia and mycoplasma and ureaplasma organism and treat accordingly. Then only it will not recur and complete healing will be there. So that is about the abscess. But neoplasm and vulvar cancer, I am not the person to talk about that. Oncologists will be dealing better. And how should vulvar and vaginal intraepithelial neoplasia will be managed? Intraepithelial neoplasia we can prevent with HPV vaccination. So we have to know about the HPV vaccination. All the girls should be given HPV vaccination, and government of India is also considering about free supply between 9 to 14 years of girls, and if necessary, we can make them available up to 26 years. And about the after coming of the neoplasia, once again, I will refer the patient to oncologist. I will not handle. And what are the current guidelines to the treatment condition of the lichen sclerosis and lichen planus? Lichen planus, especially when it is most of the patient, application of some steroid ointment, they have to diagnose it biopsy, and if it is there proved, lichen planus can be better by the application of the steroid ointment and antioxidant and vitamins. Whereas lichen sclerosis is a progressive condition, sometimes may lead to, that is, stenosis of the vaginal orifice, shrinkage of vagina, all these things may be there. So it may need surgical intervention by the appropriate gynecologist. There are cosmetic gynecologists are there, so they may help it. Thank you.
Thank you, sir. That's all from our audience. So, sir, it was a wonderful session, sir. And before concluding, sir, any last remark from you?
No, we have to, that is, we have to know many things to take care of the sexual health. So especially women has lot of changes as I have pointed out. So it has to be attended regularly. We have to teach our children from the childhood onwards how to clean, how to be safe like that. So all these things we have to teach the thing, because the sex abuse is common, or even without that, hygiene has to be many risks there for women. So all these things we have to instruct them. Thereby, we can improve the sexual health of the women, and that is very important. I have to convey. Thank you very much.
Thank you so much, sir, once again for joining us today. And with your permission, I would like to conclude today's session. Thank you.
Thank you, Shriyan.